This afternoon, 10 on Your Side brings you a special coronavirus digital discussion about the pandemic. We have them on most Monday afternoons at 1:15, and today we are talking specifically about some new numbers, COVID numbers in Hampton Roads, gathered by a local doctor using COVID rapid antigen test. Joining us is Dr. Bryan Fine, founder and CEO of Percentric, a private medical practice exclusively for businesses. Dr. Fine, welcome back.
Thank you very much, Stephanie. Nice to talk to you.
So we have seen COVID numbers on the rise here in Hampton Roads over the last few months, especially after the holidays. And every day we report on the news the number of positive cases, the percent of positive cases as released by the Virginia Department of Health. But your business has been looking at numbers and testing a little bit differently through a specific population. Tell me about the rapid testing that you're doing.
Yeah, so it's a rapid antigen test. So we have antibody tests, but that's not what we are routinely doing. So it's the rapid antigen test. We're able to provide results within 15 minutes. We are finding that in many cases, it appears that it's reliable and accurate. There are some circumstances where additional testing is recommended. But yes, we work with businesses and individuals at this point and just help them navigate this complicated space.
And just mid-November, you indicated you guys have gotten through 500 tests so far and have come up with some insights and information through that testing. What have you learned?
Yeah. Now, admittedly, so this is small numbers compared to public health, and as far as the power to be a study. But in our little space, we are finding about an 8% positivity with 500 people. And that is a mixture of asymptomatic individuals and people who come forward with symptoms. We are definitely seeing a higher positivity in people who present with symptoms. So in the asymptomatic population, it is probably less than 5% as far as the number of positives we've gotten where people describe no symptoms at all. But when people are describing symptoms, and honestly, it's not fever very often. Frequently, sore throat, sinus-like symptoms. We are seeing about 20 to 25% positivity in that population.
So what do you think then about all of these fever screenings that we're still doing at schools and so many businesses before you'll let anybody inside? We all want to check somebody's temperature before we let them in.
Yeah. I mean, I think it's tricky. So we're all learning together over the last year. And so I certainly don't challenge it or dispute it right now as a way to try to get your arms around these things. For me, it'll be interesting to see how history looks back on fever as a screening tool. People are becoming increasingly familiar with their own temperatures these days. And, what is a fever and what's not a fever, that conversation has shifted quite a bit as well. But yeah, I think that when we look back on the data and we have enough from a public health perspective, I don't know that fever is going to be a primary symptom that can identify COVID-19 infection.
It's interesting that you mentioned that congestion and the sinus-like infections. So my own mother told us, oh, I just have a little sinus infection. I get them every year at this time, or I just have a little cold. We thought, well, you haven't been out to get this. And it turned out eventually, yes, she did have COVID. So I'm wondering, you're seeing that a lot too. What about all those folks out there who say, I just have a little sinus infection. I'm okay to go to work. Should they go out and be tested?
Yeah, I mean, it's really challenging, Stephanie. And I've started to use an analogy like snowflakes, because every individual and every business has a lot of just unique components to how they view COVID, whether there's a third party that's requiring them to get tested, whether there's family members who are considered high risk, their own personal anxieties. I don't feel comfortable making a blanket statement that anybody who has any runny nose run out and get tested, because right now it still costs something to get tested. It still takes time out of your day to get tested. And it's challenging. All I can say, like you have described with your family member and we have seen, is that we see people who are positive who are describing pretty routine sinus infections. And so I think everybody needs to take that into consideration in their own space. As you and I discussed a little bit earlier, nobody needs to get tested in their own individual space. You can always isolate and quarantine and be very judicious and let things ride out. So we're all educated now about this, obviously. So I'm just trying to describe the data and what we're seeing.
It's interesting that you mentioned you don't really even need to get tested. I want to talk about that a little because it's true. You could just, if you have symptoms or you've been exposed, you can just isolate yourself for a couple of weeks. So who really should get tested? Is it really based on if you work somewhere or if you go to school somewhere? Are those the people really that should be tested?
Well, it's a little bit overstating it because there's not a lot of people who can just sit in their home for 10 or 14 days without sort of outside influences. And it's not just about what a workplace wants. There are different kinds of workplaces. So some workplaces, an employee comes in and works in isolation, while other workplaces, food service or customer facing, an employee who coughs, even if they've tested negative 6 times, is going to generate anxieties amongst clients and customers. And so it really does get quite challenging. And, a lot of the testing we're doing is driven by, obviously, third-party requests, wanting a safe workplace, co-workers wanting to be reassured, individuals not wanting to get their co-workers sick. But everybody needs to work. Businesses need to run. And so everyone is, figuring out their risk corridor. I wish, there seems to be this hard line that says, well, if you have symptoms, do this, but if you're asymptomatic, do this. And unfortunately, while that seems very clear cut, the truth of the matter is there's quite a bit of gray area where somebody with a scratchy throat or a runny nose that they get every year, you can kind of squint your way through some of these conversations. And I get it. Like, it's really difficult. We all carve out our space, and then we are looking at other people and sort of judging the spaces that they've carved out. And we are just trying to help people navigate that.
And you said a lot of this is driven by anxiety on the part of maybe the boss or, the CEO at a workplace or the head of a school. But how much do you think that the anxiety is affecting folks on an individual level? I know you deal with a lot of people that are workers, people who've had it. How much is that anxiety playing into their health?
Yeah. I mean, this has been a concern of mine throughout. And by anxiety, to be clear, I don't mean in some clinical, deep mental health state. I just mean natural anxieties and uncertainty. There's just so much information out there, and it's hard to even classify, what is misinformation. And people are trying to figure this out on their own. And so anxiety around the risk you might be putting somebody who's in your home who's a cancer survivor, or a business that's trying to manage a workforce while staying afloat and meet the needs of there's just sort of magnified everyday anxieties. And it's not everybody, but there are certainly a subset of people who really are, whose anxieties have driven to the next level. And we can manage and mitigate. But at the end of the day, when you're working with somebody who has been deeply affected, either by COVID, by an illness or a death in the family, or by their own personal history in other medical space, you just have to take it case by case. You have to talk with each business case by case to understand what they're trying to accomplish, because sometimes the answer is, I don't think you need testing at all. And sometimes it's just the opposite. So
there's another kind of testing I think we brought up at the beginning of this discussion, which is an antibody testing. We're all going to be talking about that a little bit more now that we're getting the vaccine into the community. Tell us a little bit about antibody testing and what we hope to learn from that, and how it can maybe get us back to a little bit more of a normal.
Yeah. So antibody testing here in Hampton Roads may start to be part of the equation, because right now what we've got is people who've never been sick, people who are currently sick, people who were sick, and people who are vaccinated. We've got them all in the same place. They're all coming into the same schools in some in some areas. They're all coming into the same workplaces. And how are we figuring this out? And just as a brief primer, an antigen test represents the actual virus itself. As you know, in medicine, we look at it kind of like a ball. And an antibody is kind of like a Y. And when you naturally get sick with an antigen, an antibody comes and kind of, you generate antibodies to attack antigen. And so people who've been sick will generate antibodies. And what the vaccine does is it generates something in your body so that you can create antibodies so that the next time you get sick, or if you were to be infected, you would have antibodies to fight it. And so looking for antibodies now, and I would say especially people who in the last 3 or 4 months in Hampton Roads, not so much 8 months ago when this was not prevalent here, but if you've been sick in the last 3 or 4 months, and you know, an antibody test may be able to help you figure out if you were sick then. It may be able to help you understand your urgency for vaccination. Some people who've been sick and generated their own antibodies, there is discussion out there that maybe they can wait on their vaccination for other higher risk individuals or something like that. But antibodies are complicated. I've simplified it considerably here, but I do think that there's increasingly going to be a role for these tests moving forward.
And where will we get these tests, and how will that help us move into maybe more of a normal?
Yeah, so most urgent care centers have antibody tests. We have antibody tests, just like, you know, antigen tests. It's a big difference is that antibody tests are blood tests, generally going to be a finger stick, as opposed to the nasal swab or oral swabs. Some people may prefer a blood stick, from our experience, to the nasal swabbing. But they should be readily available. They haven't quite had the run on them as antigen tests and PCR tests have had. So antibody tests, my main thought and consideration with them, though, is that I do think they need to be done with when people have access to some sort of clinical guidance to help them understand what the antibody test means. It's different than just a yay or nay that we see with antigen testing.
So if you get this test back, you'll want a doctor to be able to maybe help you make that decision on whether you should get the vaccine or wait a little bit and let somebody else have the vaccine.
Generally speaking, yes.
Okay.
I know it's not that easy. I mean, as far as the access to physicians and nurse practitioners and stuff to do that, but they are complicated. There's different kinds of antibodies at different states and illness, but I do think they can be helpful.
Okay. I guess in a nutshell, after your months of testing and now antibody and antigen testing, how would you classify what's happening in our community as compared to maybe the rest of the state or what you're seeing out there?
Yeah, so, you know, we've clearly been hit at this point. You know, my wife and I, my wife's a nurse and she helps and does tests with us. You know, 4 or 5 months ago, we were saying things like we didn't know anybody who knew anybody who had COVID. And now, obviously, we're seeing friends and people in our circle who've had it. You know, I have a small cohort where people that we've done are generally doing well, but that doesn't in any way dismiss the challenges that are being seen, especially with vulnerable populations. So, you know, we are right now in the thick of it, and, you know, how this is going to play out and how the public health conversation will evolve with vaccinations. I mean, as you might imagine, we're taking a pretty conservative approach. And by that, I mean, people are being told, you know, once you get vaccinated, you still want to be doing all of the things that you were doing before you were vaccinated, as far as masking and hygiene and isolating and not, you know, we don't know if you can still spread the disease. And under that umbrella of uncertainty, I don't see us freeing up a whole lot in the next couple months. I think it's going to be sort of a slow process where people are starting to get comfortable. But I am hopeful that by summer, certainly, and, you know, looking forward to the kids going back to school in the fall, I am optimistic.
All right. I know we've tried to simplify a very complicated thing there in testing. And so, Dr. Fine, I thank you so much for your time and for breaking that down for us. And I will have a recap of our digital discussion coming up later today on WAVY News 10, starting at 4. Again, Dr. Fine, thank you for your time.
Thank you so much, Stephanie. I appreciate it.
All right. And thank you for watching. I'll see you back here at 4. Have a great afternoon.